Welcome to the Dementia Care on Air podcast series. I'm your host, Anna Chodos, the Executive Director of Dementia Care Aware. The goal of this podcast series is to bring you short, educational moments that will help you detect dementia and care for people living with dementia. And we're especially focused on how we do that in the primary care environment in the real world. We're going to have a lot of information that mimics what we have on our website and in our other educational modules. But we're also going to have conversations with experts and other people in the community in the field of dementia care that just help us do a better job of caring for people living with dementia and connecting them and their care partners to the things they need. Today, I'm really thrilled to welcome Meg Wallhagen, who was an instructor, an educator, and mentor of mine as a trainee at UCSF. She's a nurse researcher at the Center of Gerontological Nursing Excellence here at UCSF. And I could say much more about her, but I think a really important aspect of why we're talking to Meg today is her leadership, her expertise on hearing loss and what we know about it and its impact on health, and especially the health of the brain. So brief introduction there, because again, we could go on forever. We're going to talk and refer back to our webinar, actually from April of 2024, about the role of hearing on physical and cognitive health. So I'll refer everybody back to that resource, that video and those slides. But this is going to be a more free-flowing conversation about this issue. So welcome, Meg. Thank you so much for joining me.
Well, thank you so much, Anna, for a very kind introduction. Yes, and you're right. I mean, I've been teaching at UC for quite a long time now, but I've been engaged in issues around the problems related to hearing for a large number of years, and am excited to have the opportunity to talk with people, anybody, about hearing loss.
Well, you had a big impact on me and I think set me up really well for caring a lot about it, realizing how important it is. So I think I'll just start there with my first question, which is, how do you generally frame the overall issue of hearing loss, like how important and how frequent it is?
Well, first of all, it's really important to think about hearing loss in terms of how rapidly it comes on and also the meaning of hearing to individuals. We take hearing like we do so many senses for granted, so we don't realize its importance until it's lost or we start misunderstanding. Because it comes on slowly, many individuals don't even recognize the fact that they have some difficulty hearing. But the truth is, hearing serves so many purposes. I mean, it's important for communication, for individuals, for engagement, for things we like to do, but it's really important in terms of warning signals. Sirens are high-pitched. It's important for feeling engaged and feeling like, because it causes depression when many people have some difficulty hearing. But more and more, we do realize that the importance of the stimulation of the brain probably has an impact on cognition long term, because when we have some hearing loss, it's such an effort to listen that it takes a lot of cognitive reserve to just pay attention and know what's going on. So it just covers so many areas of life that I think people really need to understand it's important. And it's part of healthcare. There's a lot of stigma around hearing loss, people associate it with aging, and yet in truth, people across the age spectrum have hearing loss. And it shouldn't be. It shouldn't be a stigma because it really is part of general health, just like all the other sensory systems that we have.
The way you sort of framed the meaning of hearing for people is really, I don't know, somehow really makes that, like, highlighted that for me. I kind of saw it in bright yellow because I think you're right. We really do not, or I, think in general, people do not think in bold enough terms about how important this is in all these many domains. You really frame that so beautifully. So good point that hearing loss is somehow associated with older age and really does, that's not where it's limited, but sort of what are the contours of hearing loss or the kind of hearing loss that in healthcare where we should be attuned to?
Well, one of the things that I think is important to realize is that as we get older, one of the things that does happen to most individuals is that our hearing becomes less acute, but it becomes less acute, especially in the high frequency areas. And the high frequency areas are where our consonants tend to lie. And what we've not realized, or many people don't appreciate, is that our understanding of words is really dependent a lot on the consonants in words. And if you look at crossword puzzles and you get the vowels, you may not be able to get the word, but if you get the consonants, you may be able to guess it. So it's sort of the same thing with understanding. So people, as they begin to lose this acuity, become less able to understand what's going on. They think people are mumbling. They don't realize how bad their hearing is. They blame it on others, or they sort of fill in, or they just disengage because it's too hard to listen. So it's, and I think the other piece that I think is important that I really appreciate more and more is that those of us who don't have hearing loss or don't have very significant hearing loss at all can't really appreciate what it's like to have hearing loss. And so we forget when someone does have hearing loss that maybe we need to speak with people a little bit differently and understand what hearing loss really is. Did it answer your question?
Yeah, it did. It really did. And but let me ask this question. I guess how many people have hearing loss? Like, is this something?
Oh, well, it depends on how you're measuring it. If you do strictly audiometric testing versus having self-report, but there are reports that say up to 80% of people over the age of 80 have hearing loss. And it certainly begins to increase quite significantly over the age of 65. So it's very prevalent, very common. And I think sometimes it's underappreciated because it's not assessed very often.
I'm going to put a pin in that because we should talk about how we should be assessing it, especially in like a routine kind of screening way. But before I do that, something you said earlier, the consonants issue, like I imagine a lot of languages, that's the case that you can mostly get the meaning if you can make out the consonants or those sounds. Is there any language difference in terms of how much impact hearing loss has, or not really, or you don't know?
Well, it's an interesting question. It's been an interest of mine for a while in terms of whether tonal languages are different than, the ones with our own alphabet and so forth. I don't think it's super different in terms of certain languages that use sort of the same kind of alphabet and whatever for us. But there's not a lot of data that I've been able to find on, say, someone who speaks Mandarin. But some of those tonal things are also high pitched. So whether that's a misunderstanding too, but I haven't seen a lot in terms of the actual different audiometric kinds of things, but it is something that I think audiologists are becoming more and more aware of.
Thank you. Um, so how should we be approaching hearing loss? Like, what should we be doing different in clinical care?
One of the things that I guess I have somewhat low expectations in some ways. I just wish everyone would walk around with a big button that says think hearing. And even if I mean, it's true for anyone, that the kinds of communication strategies we used in general conversations should be used with persons who have hearing loss, but more specifically, be more deliberate about the fact that when you're in a clinical setting, making sure the person understands you, ask about difficulty hearing. Even if you don't ask them specifically about, do you have hearing loss, which is a good thing to ask, although many people will deny it, is make sure the person actually understood you. Make sure that you look at them clearly so they can see your face, because we all lip read to a certain extent. Don't shout, because basically you're just making the sounds louder and it doesn't make them clearer. And your voice changes. So you sound more angry when you raise your voice. If someone asks you and says, what? And they don't respond, if you repeat it right away, use a different phrase, use something, reword the thing, because maybe that'll make it a little easier. So I think in clinical practice, the thing to always be aware of is in any encounter, just make sure the person really hears you, understands you. And by asking about it and by sort of acknowledging, I want to know about how well you're hearing, or do you have any difficulty hearing? Has anyone told you you've had difficulty hearing? You're normalizing it. You're saying, telling the person, this is part of your health. It's really important for us to have good hearing, just like it's important to us to have good cardiovascular health. It's part of our overall health thing. So normalizing it. And I think if a practitioner mentions it, it's really important. I've seen situations where partners will say something about someone's hearing and the person doesn't attend to it or sort of assumes that they'll deal with the thing and they don't want to admit that they have hearing loss. But it's amazing that if their practitioner tells them that they have difficulty hearing and they should have it checked, it has a powerful impact. We've shown that, and studies have shown. So practitioners need to know they have a lot of power. And it, as I get to say, it values the hearing as part of health.
The image that's coming to mind for me is how when you're a kid, you get these routine hearing checks, right? And so the importance of it to, if there's something they can intervene on, or certainly importance to normal development, um, and support, obviously, if the person has, low or no hearing, like that's just so baked in, and we have nothing baked in for middle age and older people. It's all, presentation based, or it has to rise to the surface of concern so often. And I would say even we notice it a lot and then we still don't really take the next step. So what should be the next step? So I really appreciate you sort of outlined different ways that we could assess it and ask about it. I'm assuming if possible, you'd refer to an actual hearing
Yes.
test. Okay.
Yes, no, it's really important for two reasons. And one thing, just to follow up on what you were saying before, is an audiologist had mentioned at one point that if you saw an audiogram from a child and it looked like they had hearing loss, they'd immediately want to do something about it. But if you had the same audiogram as someone who's older, they sort of say, oh, you've got, age-related hearing loss, and not do much about it because it's like, well, that's an expectation. But that doesn't mean it shouldn't be corrected. Now, yes, I think in terms of assessments, one is referral is important. If someone does have hearing loss, referral for a really thorough audiometric exam is always important. That's especially true if it's like unilateral or anything different, assessing that you always look for earwax naturally. But if you refer them, especially if it's say unilateral, because that should be checked out to make sure there's nothing else going on, unless the person happened to have a blast injury in one ear or something like that, where it's normal or it's expected that they might have some difficulty. So, and then in clinical settings, more and more, there are questions that can be used that might refine. We're actually testing to see if there's some single item assessments, but doing some assessments, whether it's a finger rub standardized or the whisper has also needs to be standardized. But more and more now, there are some on iPhones and so forth that people can do that they call a number and it does a digit kind of response and it can tell someone if they have some difficulty hearing or assess them so they can do it themselves. There's the Hear Who through the WHO that has their own assessment that they can do online. So there are some things that I think we can start using that are more specific, more refined. But the other thing to remember about any hearing test, and this is true if you get an audiometric test, when you're listening, unless they do words and noise, in other words, have you respond to certain sets of words when they have background noise of some sort, it's harder to say what you're experiencing because hearing those beeps isn't what we do in normal life. And we have context that we refer to when we're talking, we interact, there's noise around the, where you're working, where you're experiencing communication. So that kind of audiometric test can help in terms of acuity, but it doesn't totally give you what you're experiencing. So if someone, and this is maybe going a little bit into what you're going to do in the future for what you want to ask, but it is important for individuals who do get assessed, who go to an audiologist or a healthcare practitioner to get their hearing assessed, to make sure that you tell the person the situations that you have most difficulty in and the situations where you most want to hear. Because again, when we think about treatment or the kinds of adaptive devices that one might wish to have, it'll vary depending on the individual's life and what they experience, how often they go out, what they are engaged in. And people don't always need expensive hearing aids. So there's a range of options. The important thing is to get the option that addresses your need and your hearing loss, because so many people will say, I want the smallest hearing aid. Well, that might not deal with your hearing loss. And actually, to be honest, most of the hearing aids now are so tiny you can't see them anyway.
I'm going to continue on this path, and I do want to make sure we swing back to like specifically this connection between physical or cognitive health and hearing. But you brought it up, so can we talk about what we would do, kind of as you were alluding to with the kids? You know, if you notice hearing loss, you would immediately, you know, quote unquote, immediately do something. What is it that we should be doing? You know, we get the assessment. What are the options? Because I think probably everybody just goes straight to hearing aids. In geriatrics, we talk a lot about pocket talkers because they're sort of not individualized, they're much less expensive, and they're sort of pretty good in an improvised situation, I would say. But how do you sort of walk people through the options?
Well, if the person can go, now unfortunately, Medicare still doesn't pay for hearing aids in the setting. But we now have an option for over the counter. And I'll talk a little bit about that. If you get an assessment and you get the pure tone average, what the audiogram looks like, the audiologist should explain it, explain where the losses are. Most of the hearing aids now that you get are refined enough that they amplify where you need to have amplification, and they don't amplify where you don't, because the older models would amplify almost everything. And that's one of the reasons people felt they weren't always very helpful. But you don't always have to get the most expensive because they keep adding fancy things to them that you don't necessarily need. So it's working with the audiologist if you decide to get a hearing aid. But the other options are, is, for instance, if you really are home a lot, if it's a person who is homebound and doesn't do a lot in terms of going out, they can potentially get just an assistive device, such as a pocket talker or other kinds of model like that. There are some, the duet, there's other kinds of things that can be just used when you're talking to someone like your family comes to visit or something like that. So there's a lot of other devices that you can get besides hearing aids. You also have to know that hearing aids by themselves won't necessarily solve the problem either. In other words, they're best in personal types of communication in short distances. They're not good if you go to a church or something like that, or you go to any kind of house of worship that has or any place that has high ceilings or reverberations. Those are settings where it would be nice if most of them have what we call induction loops. If you had a T-coil, what's called a T-coil in your hearing aid, you can turn that on and the induction loop sends the information directly to your hearing aid and you hear much more clearly. People who have hearing loss swear by those. If your hearing loss is really significant, you may be a candidate for a cochlear implant. They're putting those in persons across the lifespan. So it's not so age dependent anymore. You do need to work with them if they get a cochlear implant. You have to know that the sound is quite different. It's a digital kind of sound, so you have to relearn how to understand. This is not something that someone who has difficulty with any kind of cognition probably would be eligible for, because you do have to get used to them. But the results for persons who are older are pretty good. But you can, as I mentioned, with the other kinds of devices, and if you have a hearing aid, you may need a microphone or something else that will Bluetooth into it. Certainly, the other thing is to always get captioning. And now you can, on your iPhone, get various kinds of systems, whether it's Otter or Ava or other kinds of things. If someone talks to you and you have your iPhone on, you can read what they're saying. If you happen to need, and you have a landline or a phone in home, you can get a free captioned phone because that's part of our phone system. So there's such a range now that's available that you really need to think about. And, if you belong to a place now, I'm biased because I know HLAA, the Hearing Loss Association of America, is one of the associations that has a lot of information. And if you belong to a group, or there's an older adults, there's another group, ALDA, that also has groups. that you can join and you can learn a lot from individuals like that too, in terms of how they deal with stuff.
Oh my God, we need so much more of you and your knowledge just sort of disseminated throughout primary care and general care. Because the thing I kept thinking about as you're going through all these options is what you said earlier, how important it is to understand where that person really wants to hear, where they want to maximize hearing. If it's family functions, like you said, religious observances and rituals, or going to church or whatever it is, like if that's really important, or if it's going to plays or opera or whatever it is for that person, like really finding something that's going to help them do that. I'm
Right.
just imagining like how much more important and impactful it would be to help somebody with a specific part of their life where they're feeling diminished, related to the hearing loss. This is incredible, and I'll second the point about how challenging it is to afford them and why these other options, because a lot of my patients have smartphones, and even if they don't have expendable income for a hearing aid, and just how that might open up some options with like some of these transcription services, and those are available in a ton of languages. So
Yes. And they're also, if you're not using them, still believe this is true, is that many of them are free if you don't use them extensively. You can buy, premium models and so forth if you're using them all the time. But if you're just using them for a certain number of minutes, they can be free. So if and there are over the counter, although the thing about over the counter, depending on the person, and this is a fairly new thing. It came in just over a year ago or so. They finally put them out where these are not what they call personal listening devices that used to be unregulated. These are regulated and they can be called hearing aids. They can be bought over the counter, but some of them aren't super inexpensive. I mean, you can still get maybe $3,000 for a pair. And for persons or resource challenged at all, that's a lot of money. And people may not be willing to put that out for a hearing aid, unfortunately. I mean, it's priority, whether whether it's my priority or somebody else's, but it's a fairly good chunk of money. So in that situation, it may be better to think about some of these other options. People have to value their hearing to do it and be motivated. But if they think about it in terms of their health, I wish it was, prioritized a little bit higher than it is.
where would I get an over the counter hearing aid? Like whose counter would I go to?
So I walk through, I see now like CVS, they have ads for over the counter types of things and in some of the stands. Actually haven't seen stands that actually had them, but you can get them online. Various groups actually they look kind of like a regular hearing aid. They vary in the cost in terms of whether it's a pair, and they do vary in terms of their functionality. You should always make sure if you're getting them that you have the dexterity. If you have a lot of arthritis or you have other kinds of, if it takes manipulation to fix, to adjust it, because they come with needing adjustment to try and get it to fit your hearing, you really should make sure you understand what you're getting and make sure there's a return policy so that if they're not working for you very well, you can either get advice or get assistance online. But they're relatively, I think I believe that there's a range of places that you can buy them, although I haven't scoped out those places myself yet. It's one thing that I would like to do.
Thank you. I appreciate you venturing into that, because I haven't looked enough, but it's not like I walk into Walgreens and see a whole wall of,
Right.
right. So this is so helpful. And then I think another point I will just make, and I think you taught me this a long time ago, is that as someone's going through the process of getting a hearing device, if that's kind of the right next step, that I sort of coach people to expect the need to adjust or return to the audiologist or whoever's providing the hearing aid, because as you were saying, it's not often like out of the box perfect fit and perfect functionality with what they're hoping for. And I even know some people, definitely people with more means, but people who had to return a hearing aid get a different kind, like they went through different models, and then once they found one that really worked for them for whatever reasons, now wear them all the time. But until then, we're really reluctant when they didn't didn't have that fit. And I always think of it as like sort of like the right pair of glasses that are comfortable. You feel like they look okay, they give you what the functionality you're looking for. So,
Yeah, I would, I would like following up on that a bit. I think it is important, as you mentioned, to emphasize that it isn't like reading glasses in one sense. Your brain has to relearn how to listen, and you've usually been without hearing for a while, so you've got to get used to the sounds, and people often don't have that kind of patience. So it does take a while. Often they do need readjusting. So don't, and we pay for most of the services that we're paying for when we go to see an audiologist are bundled services. Some of them are breaking it apart now, but you're not just paying for the hearing aid, which is probably a small part of the bill in some ways. What you're paying for is the service. And so take advantage of the service, go back and get it adjusted if you need to, for sure. And they might not want to turn it up to the ad, to fit you perfectly initially because you have to get used to the sound. But wearing them is helpful. Trying to maybe challenge yourself, wear them as much as possible to get used to them. And you will hear other sounds that you haven't heard before or haven't heard recently. Let's put it that way.
okay, I think you're starting to venture into this territory of the hearing cognitive connection. So I'm going to pursue it. That's really interesting what you're saying, that people are kind of need to relearn to hear. And what I recall from some of the things I've learned from you earlier is just that we over time, often people are living so long with some amount of hearing loss, they lose discriminability, they lose the ability to hear as they did before. And so now they have these hearing aids, which are, a big jump, or some other device, and they can't actually understand what they're hearing because they've sort of relearned how to hear sounds. So that really speaks to the fact that hearing and the brain have this ongoing relationship. It's not a fixed thing. So, can you take a little step back and just frame what we know about hearing loss and cognitive function, and like how we should think about that?
Sure. It's an important question because it's in the news so much right now. And I think it's important to point out as we talk about hearing loss, in truth, we hear in the brain, we don't hear in our ears. I mean, but the brain has to get signals that are appropriate for it to make sense of what's going on. If you don't have hearing, or if some of the hair cells that are sensitive to sounds become less sensitive and you no longer are getting those signals, the brain can't make sense of it. And it works really hard probably to make sense of what you're hearing, which takes a lot of effort. And I think the more we learn about it, first of all, it's important to understand that hearing loss is related to a lot of negative health effects, both in terms of depression, isolation, falls. That may be partly vestibular, but different kinds of functional activities in general. And so when we think about learning more and more about the relationship between hearing loss and cognitive function, there's not a clear understanding of exactly why that's true. There's many hypotheses, one being actually that it's mediated by the fact that depression and loneliness and isolation also are related to cognitive function. So it may be that because hearing loss causes these other things or is related to these other things, those are the main drivers of the cognition. There's other thoughts that just the fact that the brain is not receiving those signals, and those signals, the brain all works together, the brain changes. It's kind of like a muscle. When the muscle isn't used, it sort of says it's going to do other things, and the muscle fibers don't do very well. Well, the brain has to keep getting stimulated. So it may be sort of a direct effect that the hearing loss is not stimulating, and you're almost like a social isolation thing, that you're in situation where you're just not getting any stimuli at all. So there's not a clear understanding of the relationship, but there is more and more information that suggests that yes, there's an association between hearing loss and cognition. And one of the reasons that it's gotten more press, if you will, is that there's a thought, and if you look at all the risk factors for cognition, hearing loss is one of those risk factors. but the feeling often is it's something that you can do something about. So by helping mitigate the problems related to hearing, you may be able to mitigate its negative impact. But I would say that probably overall, having a healthy lifestyle in addition to doing that is critical to cognition. So I always think, because I worry that people get so afraid, and I don't want them to buy hearing aids based on the fact that someone's telling you, come get your hearing aid, you're gonna, so you don't get demented. That's not a, you shouldn't believe that, because we don't know. And certainly the most recent studies that tried to study this, the persons, they call them at risk, and they call the other ones, that's when the hearing aids seem to have some kind of effect on slowing the downward trend of cognition. But we don't have good data that says hearing aids solve the problem. That said, hearing aids and helping your hearing is critical to so much of health that it does help your cognition, but not, there's not this perfect relationship, if that makes sense.
Uh-oh, Meg, because I've been trying to scare all my patients into getting hearing aids to treat their cognitive decline. Whoops. Um, well, I'm a believer. I'm certainly a believer. And I think we've all seen that effect when you have a patient who really can't hear, you help them correct hearing and you're like, oh, they're there. They're part. I mean, it's just this awareness that it at the very least affects their presentation, their ability to
Yes.
interact in the world in a, fully kind of connected and coherent way. And okay, well, thank you for I want to just I'm gonna deep dive into one little point you made, which is I think maybe you're referring to there was a study, I believe Dr. Frank Lin, who is the main researcher in the area, like measured how often people were correcting their hearing or like wearing their devices in an at-risk group. So they didn't have dementia, but they were at risk for dementia. They had a elevated risk for other reasons. And they progressed less than the people who weren't correcting their hearing. And there was some association with like the amount that they wore or like they on average they only wore their devices like a third of the time that they could have and they
Right.
still had this benefit. So I have taken that a little bit to mean that it is part of this like modifiable risk factor package, and if we
Right.
do correct we may be having a healthy positive impact on the brain. That's sort of what I took from it, but and I can just tell you're pretty cautious about saying like for sure if we correct hearing we're going to radically reduce your risk of dementia or but we do I will say in our program we definitely promote it as sort of like one of the brain health moves that we can do to really help people.
No, I think that's the framing that I would like to see, that it's part, as I say, it's part of whole health. And so you're really mitigating more than just the fact that, it's anything that stimulates your cognition. And we talk about that in terms of benefiting your brain, whether you do games, do whatever it is, and staying engaged is an important one. You need hearing in general. And we're talking about people who have been hearing most of their lives. We're not talking about people who use sign languages or other things like that. But this is a way of keeping your brain stimulated. And that's an important factor for cognition for sure.
That's really helpful. It's so interesting to think about why hearing would, potentially impair cognition or lead to a higher risk of dementia. And you've just framed it so nicely all the way through that like it clearly has all these other effects of being more isolated, not being able to challenge or sort of engage your brain in other ways. And yeah, you just do such a great job of like emphasizing that whole brain, whole body perspective. Okay, I think my last question is that actually didn't occur to me until we were talking. How should we be protecting our hearing? I mean, I think that's the other piece of this. We're not doing a lot of preventive care around hearing loss. I think if you're in certain occupations, you might be, but are there other things we could be doing? Because I guess I'll also point out my understanding is a lot of the data shows that middle aged hearing loss is associated potentially with more cognitive, higher risk of dementia later in life. So both later life, middle age. And so there's a lot of time there to protect hearing, certainly. So any tips on that we can carry over?
Well, yes, I again think it comes back to my first point about think hearing, because when you're young, you take hearing for granted. So I'm a I'm a real believer in earplugs for protecting your hearing, inserted properly. People who are in noise exposed occupations should use hearing protective devices. Most occupations now are supposed to provide those, according to OSHA, the regulators and so forth. Unfortunately, some people don't like to wear them when they're in those situations because they feel that they're minimizing some of their environmental inputs. But there are some newer devices, and so they need to talk to their employers or whatever to get the appropriate kind of protection. I worry a lot about persons who go to these games that accentuate the noise. And I think it's so important for persons to bring, the stadiums and so forth for sports are so noisy, or bands and everything, and people are screaming and yeah, it's unfortunate. And I know that noise seems to be exciting for people, but trying to protect it and minimize the decibel level that you're exposed to is important, because even if what some of the data suggests is that if you're in a very noisy place, and sometimes we're left with tinnitus after the fact, ringing in the ears for a while, and then it goes away and you think, okay, it went away. But there's some data that suggests that the actual damage to the ear is somewhat ongoing, that little sensory cells may be continuing to have some problems because of reactive oxygen types of stimulation, the stress of the noise and so forth. So the accumulation of exposure becomes really important. So protecting your hearing when you're in various situations, whether it's really good earplugs or something over your ears, not listening to noise continuously at high level or music at high levels over time, being careful about where you are in situations in terms of the noise level. And I guess it's partly awareness, but also willingness to sort of wear earplugs when you're in those noisy situations. I'd like them to tone it down, but it's hard when people feel that that's part of the experience. And those of us who are very sensitive to noise find those situations really hard. So, yeah. But one of the things I did want to say, follow up a little bit with the cognition piece, because your work is with persons, especially like caregivers and others who work with persons who have cognitive impairment, is the importance of helping the individual who has some cognitive impairment mitigate any hearing loss that they have. Because if you think about the fact that someone who has some cognitive impairment or dementia, they often can't make sense of their environment. And you can just imagine, if you can't make sense of your environment anyway, and then you're starting to get signals that they even make less sense because you're not hearing it correctly, that's going to exacerbate their experience. So I think for caregivers to at least somewhat understand that and use as good communication skills and make sure that if it's feasible, and I know sometimes it's hard if someone's really cognitively impaired to have them wear hearing aids, but maybe using a pocket talker when you're talking to them, getting them used to wearing those kinds of devices, talking to audiologists, they're not always expert in this, but being able to really think about improving the hearing to the best of your ability in the person who has cognitive impairment, so they continue to get stimulation too to their brain, which can be helpful. There's not a lot of study on that in terms of the effects, which we need, but I think it's important for persons to be very, very aware of that.
Yeah, and they may not be communicating that they're having that difficulty. So, like,
Right,
kind of
right.
thinking of it ahead of time. Yeah. Oh my gosh. Well, Meg, I've already taken up so much of your time. I'm so
Okay.
grateful. This was an absolutely incredibly useful conversation. And I will certainly leave once again being reminded to think hearing, think about it, assess it, help people access resources, think about how it's going to fit into their life. And I am exceptionally grateful. So thank you so much.
Oh, you're very, very welcome. And if people have questions, they can always reach out, and I'm willing to talk to anybody about hearing.
That's incredible, as this podcast shows. And so thank you so much. Very generous. I think I'll just point out, we'll also include some resources because you mentioned some really good ones from organizations that really focus on this and various clinical tools. So we'll put some of that in what we call the notes, the show notes for
Great.
this. So thank you so much and really appreciate it.
Take care. Have a good afternoon.
Thank you for listening and to our wonderful guests. And thank you to Lisa Costello, our audio editor and voice specialist. We want to make sure you know you can get CE, CME, and MOC credits by going to our website, clicking through to the podcast page, and answering a quick quiz to claim credit. This is all possible through support from the California Department of Healthcare Services and the hard work of our Dementia Care Aware team. If you want to learn more, please visit our website, dementiacareaware.org.